Meantime, the Pennsylvania Department of Health has announced the first confirmed case of a COVID-19 variant in the state. That confirmed case is in Dauphin County. Dr. Rob Danoff is the director of Jefferson Health Northeast COVID Testing Center and joins us now to talk about this new strain. Good morning, Dr. Rob.
Good morning, Jim. How you doing?
Doing very well. So what do health experts know right now about this particular new strain?
So this is the one that was first detected in Britain. And so it's in at least 7 states right now that we know of, 22 European countries. And what we do know is that it's a little bit more, they estimate 25 to 50% more contagious than the other strains. So what that means is that it's easily transmitted from person to person. Now, the good news is they feel that people who have had this before COVID and recovered have good immunity, and they think the vaccines will do the same thing. But think about it this way. Viruses do change, right? So it's like you have a twin, and your twin is almost exactly like you. It looks the same, but there's subtle differences. That's what happens when a virus mutates or changes, and that's what happened in this case. There's also another strain, 2 of them in Africa, which they're tracing right now. And what our government is doing, and Pennsylvania included, which started in November, they are starting to track and test genetically, what type of strains are present in their country. So I suspect we're going to see a lot more of this strain that was first detected in Britain very shortly. More states will report it.
Yeah, I think initially people were very, very concerned, and I was like, well, this happens with any kind of major virus. Now, do health officials know if the current vaccines could offer any additional protection against these new variants?
Yeah, so the good news is that these vaccines are what's called polyclonal. It means that they will recognize slight changes to a virus. So the slight changes that have occurred, that the strain that was detected in Britain, the vaccine makers feel that their vaccines will cover this pretty well. So they're pretty certain about this one, but there's ongoing study. So there's some good news on the horizon for people who are getting the vaccine. And then we're just going to wait and see about these other variant strains that are coming down the line. Now, just so you know, these mRNA vaccines, they can be made, very quickly and changed. So if we need to change this type of vaccine, it may be a yearly or every other year vaccine, just like the flu shot. So they're really following these strains carefully, and we'll have more data as the months go on.
So, Dr. Rob, one of the big stories this morning, we've learned that a Sixer, reportedly Seth Curry, tested positive for COVID-19. What's the likelihood of more players contracting the virus?
Very high. I mean, he was playing on the court, breathing heavy, and this is transmitted so easily respiratory. So he was, person to person, body to body the night before. So he was probably infectious, for at least a day before, possibly 2 days before. Now, the NBA does do the rapid test every day. We're trying to do as safe as they can. But I suspect we're going to see some more cases, whether with the 76ers or with the other team that they played against, the New Jersey Nets, the night before.
So now on Wednesday, Dr. Fauci admitted the vaccine rollout isn't happening as fast as he had hoped. I've been monitoring the dashboards for the various states around here, and it doesn't look like a lot of people are being vaccinated. So what's the situation in Pennsylvania? Are you satisfied with the way the vaccinations are going?
Yeah, what's happening is Pennsylvania has a lot of doses in the state, but the latest chart shows that less than 30% have been used. Now, part of the reason is we don't know from week to week our current supply, how many we're getting. So there is some holdback because, we've identified a lot of people we vaccinated for the first dose. But now we have to make sure that we have enough doses for their second dose. So we're hoping that there's a more reliable reporting process so we know week to week how many doses we're getting. And that's what the government really has to work on that. So to answer your question, the rollout has not been the smoothest. It's less than what we were told we would have. We're hoping that it will start to pick up over this next few weeks or next month, but it's to be seen. Now, the good news is they're going to start with certain pharmacies offering it, but again, it's the same problem. We don't know how many doses we're getting.
Well, Dr. Rob, always great information from you. We do appreciate it. We hope that you continue to remain healthy and safe.
You too. Be safe, everyone, and wear your face coverings, your mask. We know that works.
Good advice. Thank you, Dr. Rob.